Welcome to UNCAGED, a show that celebrates thought leadership from today's top business leaders. The program provides a voice to amazing executives from around the globe who are shaping the world of business today and mapping the path to the commerce of tomorrow. Today, we're speaking with Karen Rance. Hey, Karen, how are you?
I'm doing great. How are you doing?
I'm very, very well. Karen, I'm excited to talk to you. Certainly, this is a topic that has impacted my life with my kids. Karen is the head of medical affairs in North America for ALK. ALK is a global pharmaceutical company. She is formally trained as an allergy, asthma, and immunology specialist, and we'll talk all about those topics and the work that ALK is doing. But before we do that, tell us a little bit about yourself and your career.
Well, thank you for the opportunity just to talk with you today. My background is primarily seeing patients. I graduated college as a nurse and then got my master's, formally trained then as a nurse practitioner, and have always been involved in the allergy, asthma space. So my early years was in a primary care setting where I focused on asthma and allergies, and then into a specialty practice. But one aspect that as I practiced and saw patients for 20 years is I was very keen on partnering with pharmaceutical companies, because I really believe that the best outcome for patients was when the pharmaceutical industry and the healthcare providers strategized, shared resources, and really enabled the patient to make the best choices. So while I was in those years seeing patients, I was on the board of directors for the Certified Asthma Educators. So that was an organization where we created and kept the accounting of those that educated on asthma throughout the American healthcare space. And also with the National Association of Nurse Practitioners, I created the first allergy and asthma special interest group. So allergies and asthma has always been my wheelhouse, so to speak. And so after seeing patients and realizing I still had an itch to paint the landscape with a broader brush, I stepped into the industry world. So first as a medical science liaison for a short bit, and then in my role here at ALK.
That's great. And I know that ALK is doing some extraordinary work. Tell me a little bit more about being a head of medical affairs. What does that mean?
Well, so for your listeners who may not be familiar with medical affairs, we can start there. So medical affairs is essentially the face of biopharmaceutical industry. And by that, I mean that medical affairs professionals are responsible for educating both internally and externally on the medical science available, and also they are involved in the generation of science and then helping translate that to clinicians. They also collect and we report insights internally. And I think one of the most important roles that medical affairs has is that we are the role of the voice of the patient, I should say, to our internal colleagues. It's an exciting time to be in medical affairs. I really see that this continued transformation, which started before the pandemic, but certainly has escalated since then. And this transformation is establishing medical affairs as the third pillar in the biopharmaceutical industry, alongside of research and development and commercial. So traditionally, decades past, medical affairs has been, if I dare say, limited to, but has been in a role that's been very supportive. And with the transformation of the digitization of healthcare, of data, of science, it's really medical affairs that are the natural owners of the scientific data, really across the lifespan of the of the products in the pharmaceutical industry. So I think that all comes together in really again, exciting times, challenging times, but there's a lot of new that we're experiencing in medical affairs, where those who may have started their career 20 years ago didn't have the pleasure of enjoying. But I tell you, Van, one interesting tidbit of info that I was recently reading is, speaking of the data generation and how fast it is going, is that there's the estimates suggest that there's 2.5 quintillion data bytes generated daily of information. So quintillion, I had to look it up. You might be better than I am. 18 zeros, okay? So, you take that and you realize, how can patients possibly keep up with everything, or even, physicians, busy, heads down, seeing patients every day. So I think this is, again, a key role for medical affairs to play, to really help translate that and be really be that voice in a number of
it's interesting. I think also, Karen, for the space that you focus on, really, where ALK plays in that allergy, asthma space, so critical in medical affairs, because certainly that data not only is a quintillion data points, but also it shifts over time, right? So it's really, really important. So tell us a little bit about, you've worked in this area for a long, long time, and tell us a little bit about how you've seen things shift and what are the big trends right now?
Yes, the biggest shift, and I think we owe this to the pandemic, which we've all lived through, is that never before in our lifetime within the healthcare space, so I saw patients 20 years, now I'm in industry, have we, has there been the top news story globally in the United States and globally that is about a health-related topic, i.e. COVID. So I think what this has done over the last several years is it has empowered the patients. Patients are looking at, okay, what should I know? And even, they will hear news reports or not news reports or this data, where can they get their information? So in that way, that shift has been very decisive, and the patient's voice is more pronounced than it ever has been. And I dare say I couldn't be more pleased, because I really think that this is where, the value incentives are, is empowering the patient. But we do see that that acceleration, and we brought it into our realm, with the allergy and asthma space, and trying to make sure that the patients are equipped. Now, medical affairs by regulation can't directly talk to patients, but we do work with patient organizations and advocacy groups. My commercial colleagues in marketing can do direct to consumer campaigns, but all of this has heightened importance because of really what we've lived through. I think the other shift I've seen, Bent, is how physicians are receiving, their scientific, the education, the messaging, the data from medical affairs. So before pandemic, my team largely, was on the road traveling, and then of course, much like everyone, went to Zoom during the pandemic. And but what we have found is the virtual space to educate physicians is here to stay. And again, I think it's an added plus. So for example, where we would at a restaurant, try to get several physicians together to have a scientific exchange, a conversation, we now can send Uber Eats coupons, to their home. Everyone is still joining for dinner. It meets all compliance standards, having a scientific discussion, but it also helps, that work-life balance that physicians, just like you and I are always striving for.
Yeah, I mean, it's amazing to see. It's been challenging, certainly, over the last couple of years to see how the pandemic has forced us all to shift the way we live and work. Tell us a little bit more, I think, on that topic. It sounds like you guys have been able to employ technology to do your work. How has it shifted maybe some of the challenges and maybe even opportunities that it's presented?
Yes, it definitely has shifted opportunities. And when we first started, so the late summer of 2020, so initially, even the physicians, they had closed their offices. We used that time for a deep dive and just did a lot of internal training. And we got very savvy on doing virtual presentations. But then we emerged late July with initially just a virtual roundtable model, and what we called affinity groups. And so we would have women in allergy, invite female physicians in the Chicago area, because everyone was suffering a bit from isolation, right? And yet, trying to empower them and encourage them, just a dialogue of how are they doing what they're doing. So we would send the Uber Eats coupon out, and because we wanted to keep the model that they were familiar with, in as much that typically, when medical affairs engages physician, it's around a meal. And so, but what we saw was benefits and value beyond our expectations. So the programs were very popular. We continued throughout 2020, 21. We're still doing them now. And it has become a mainstay, again, because I think the digital transformation is changing also how physicians are preferring to be educated.
Now, Karen, I looked at your background. I mean, I completely get, all the work that you guys have to do with physicians, but I saw that you actually have a lot of background with nursing. And I look at the world right now and, what we read in the media, there's nursing shortages, there's nursing challenges. Do you guys interact with that community?
We do in the clinical setting. So in an allergy office, because certainly allergy is our bailiwick, we will engage with the nursing, the support services, because they're often the backbone of the office. And I think that not only are we seeing these nursing shortages nationwide throughout the hospital systems, but even talking to physicians, to nurse practitioners who are leading their offices, that it has trickled down and affecting even the at the clinic setting as well. And it's a difficult time for everyone, without a doubt.
Yeah, I can see everyone's trying to use resources as efficiently as possible as we kind of shape for the near future. And that kind of drives my next question, which is, here we find ourselves now in 2022, and hopefully, and I'd probably knock on wood somewhere here, Karen, we have the worst of the pandemic behind us. But how are you guys shaping and seeing the next year or so?
Well, what we're looking at is, I think one of the biggest challenges we have in looking forward is understanding the totality of the patient journey, because the lives, your life, my life, our lives as patients, and then the patients that our customers and physicians see, has changed so drastically. So you take on top of that, what is that patient journey? We're very focused on, teaching about adherence of treatment, adherence of medication, which is quite dismal across the spectrum. So, so we're understanding that patient journey and the totality of what the patient struggles with. We seek to understand that, and then seek to translate that in what kind of data can we provide the physician that would then they could in turn enable the patient to navigate that journey that would ultimately improve their health outcomes.
Yeah, I never thought about it. I mean, it's true that holistic view on the journey has shifted quite a bit. And kind of thinking about how you can manage that will be absolutely critical going forward.
Yes, and I was even going to add, so certainly my commercial colleagues, because if you even think about copay cards and things along that line, the high deductible plans, which we've all been dealing with for a decade plus, but those are increasing in their utility, and payers are leveraging those. So you have all of these stressors, on the patients, and that is well before we get to economic parameters and others. So, I do believe that, tomorrow, the future really needs to be focused on that patient journey.
I love that. Karen, I really love what you guys are doing at ALK, and it's spectacular to see how, the area that you're focused on in medical affairs is actually starting to take a bigger role and starting to shape some of the things that we can do with all that data. If someone wanted to learn more about what you're doing at ALK, where should they get in touch with you?
Well, medical affairs at ALK.net. Certainly, I welcome any questions that anyone may have. Also, I'm on LinkedIn. That's another way to, if there's any questions that I can answer. I always, it brings me such joy to empower medical affairs professionals, because I do think that we do have a bit of a journey in front of us, because we need to make sure our commercial colleagues and our R&D colleagues are understanding this transformation to what I think, where I think medical affairs is going and needs to be.
Yeah, it sounds like there is a new model, a new shift afoot here, Karen, and I love it. I love what you guys are doing. Thank you so much for being on UNCAGED today. We've been speaking with Karen Rance. She is the head of medical affairs for ALK, which ALK is a global pharmaceutical company. She is formally trained as an allergy, asthma, and immunology specialist. And we've been talking to her about the growth and the shift in the use of medical affairs and what she's doing as a healthcare and patient advocate. Thank you so much for being on UNCAGED today, and we look forward to having you back.
Thank you so much.
Cheers.